health correspondent Nicola Hill. Nicola, what more can you tell us about this? I mean, how can they be so exact about a diet?
That's because it's an observational study which has drawbacks, which I'll come to in a moment. So basically these doctors and nurses, all healthcare workers, all people who came really close contact with patients with COVID-19, that meant that they had to be within 2 meters of them for more than 5 minutes on a regular basis. So they're all taking part in this very major worldwide study, as you said, 6 countries. And between June and September last year, as part of this study, they filled in their normal regular diet. Now, this is the diet that they always had, not one that they'd started because of the pandemic, but what they'd been eating before the start of COVID-19. And as you said, it showed that the people who either had a total plant-based diet or also ate some fish really had a much less chance of getting COVID-19 and getting severe COVID-19. Out of something like 546, I think the figure is, of the 3,000 people who got COVID-19, only 41 of them had a plant-based diet and only 46 of them had plant-based and a fish diet. And the reason the researchers were doing this is because there's been lots of hypotheses about whether you eat unhealthily, whether you're obese, whether you've got type 2 diabetes, whether you've got heart disease because of your unhealthy diet, and what impact that has on you getting severe COVID. But there hadn't really been the same research saying, well, what can protect you against it? And that's why they did this observational study. The drawback, of course, is it's reliant upon people filling in a survey. It's not like a controlled experiment. So it's people saying, this is what I ate. And of course, the other thing is, a plant-based diet perhaps in the US is maybe not the same one as you might have in Spain, and it didn't take into account other lifestyle factors. So that's why various nutritionists are saying, well, you know, more research is needed because this is an observational study. But an interesting fact I found out, that the first link between smoking causing lung cancer was based on an observational study. So it does show that this is research that people are taking seriously, and they're going to do more of it.
Yeah, but does observational mean that it simply is what it is? In other words, we know that Dr. A eats a vegetarian diet and that these are the percentage chances he has of getting severe COVID. And does it also mean that scientifically they haven't actually proven why and what's in those diets affects the body the way it does and therefore interacts with the coronavirus the way it does, leading to less likely severe symptoms?
Yeah, good question. So observational is basically just observing, and if it's self-reporting, which is what this one is, you're reliant upon the person giving the details. But there were healthcare workers. They had volunteered to take part in this study, looking at other issues as well. So they obviously, you expect them to self-report correctly. But yes, why would this be the case? Well, the other inference here is that people who have a predominantly vegetarian diet, perhaps with some fish, tend to eat more healthily. They might not be spending their time going to fast food restaurants and eating burgers and milkshakes and things like that. That's an assumption. That's generalising. The other thing, of course, is what's in your plant-based and your fish diet. Now, we all are told, you know, you should eat oily fish 2 or 3 times a week because it's got omega-3 essential fatty acids that protect your heart. Also, high in vitamin D. I mean, Adnan, that's something you and I have discussed before. You know, should we be taking vitamin D? There's been major studies looking at this ever since the pandemic because it's known that vitamin D is protective against reducing inflammation in the body. It boosts the immunity, and it's been known to be of benefit in other respiratory diseases. Now, the jury's still out with COVID-19. There's been various studies and they're inconclusive. So, you know, should we take vitamin D supplements or not? That also depends on where you live in the world. People in the UK are known to have very low levels of vitamin D because we have very little sunshine, certainly this year, until now. So that's another thing to take into account. Of course, all the other vitamins, the minerals, the nutrients you have in the grains, the vegetables that you're eating in plant-based diets, they're of benefit as well. But it doesn't mean, you know, should we all give up meat? We also know nutritionists say that eating lean meat 2 or 3 times a week is also good for us because of the protein that's in there. Many people who become vegetarian, who don't manage their diet properly, then don't get enough protein. And there was another really interesting little facet that came out in this study, but they said it's not statistically significant, is that people who had a high protein, low carb diet didn't get the same protection against COVID-19. And the reason that's interesting is that it's the new fashionable diet that's being given to people with type 2 diabetes as a quick way of losing weight and lowering their blood sugar levels. So it seems yet again it's confusing. What should we eat? Maybe just a little bit of everything healthily is the best.
Yeah, apparently. And I can tell you the reason you don't see too much sun, Nicola, is because you live on an island in the North Atlantic. Come to Turkey. Thank you, Nicola Hill.